That is literally my cat's hair flying. Hi, oh my goodness. We are live and I just caught a cat midair and now there's hair everywhere. So hi everyone who is joining us live. And if you are watching us later, yes, I should have edited this out, but I won't because life is full of surprises. And you know what? It's complicated enough to not have to edit cat hair. So, hello. I'm Magda, for those of you who are seeing this for the first time. And with me today are Hari and Heather, joining me from Toronto, Canada. Hello.
Hello. Hey, mate.
If all goes not well, I'll be calling you guys, be like, hey, anybody want to marry me for a visa so that I can immigrate to Canada?
Well, we're certainly hoping it doesn't get to that.
Oh my God.
Of course.
But just in case you guys make a list, okay? Yeah, that's the times we live in. I'm in Chicago where things are good, but my country not so good. And one of the reasons why we are doing this conference, this event, Awake, Aware, Arise, is not directly because things in Chicago aren't great, but because things on the planet aren't so great. And on many, many levels. Chances are the things that are keeping you, our lovely viewer, up at night are things that are keeping others up at night. And it's really easy to just go, I don't know what to do. And a lot of us have been doing that. But we need that to change. And we need to leverage the kinds of connections, power, skills, whatever we have to make a difference and affect the systemic problems that are affecting the world. So Coach Arya, who is hosting the event, Awake, Aware, Arise, we are all about coaching first and foremost. But what is coaching other than helping people become their best self and releasing or helping them release their potential so that they can leverage their gifts and their talents and their influence and their whatever to make this world a better place. So yes, it all ties back to coaching, we think. But Awake, Aware, Arise is all about looking at different perspectives on the different crazy and important systemic problems that are plaguing the world. And seeing, on one hand, what can we do as individuals? What can we do as coaches? How can we raise our own self-awareness? How can we help others become more self-aware? And on the other hand, we have examples of people who are doing really good things that are helping affect systemic problems in our lives and hearing their stories. Some directly relate to coaching, some don't, but that's okay because in the end, it's all about being better ourselves and helping others be better. So how, it's all related. It's all for the greater good. Anyway, I'll stop talking now because I want to give the screen over to my lovely guests today, who I will first ask to introduce themselves. And if you want to jump right into what you're going to be talking about, go for it. If not, then I will make sure I circle back and ask you. But Heather, why don't we start with you?
Great.
Who are you and where are you?
Thank you, Magda, and thank you for inviting me to this. I think your timing is great for this. I think the world needs some, reframing in some ways on, what have we learned to date in the last several months and how do we frame it for the future? And because there's a lot of positives. So I'm Heather McPherson, and I'm the president and CEO of Women's College Hospital, which is a hospital in Toronto, Canada. That has at its core values is an equity-seeking organization. I'll let Hari introduce himself.
Yeah, so I'm Hari. I'm one of the physiotherapists at Women's College Hospital, and I'm a coach. So I work with Heather, and when Magda introduced this topic, it was a privilege. It's an honor and a privilege to be part of this program. As Magda rightly said, there is a need. This is the need of the hour. It has been a wake-up call for all of us. And this talk, when Heather and I chatted, we were talking about how Women's College has been leading the charge in terms of addressing the current pandemic and the situation that we are facing. But really, above and beyond, what else can we do? What are the learnings we have had over these past 6-7 months? How have we really changed? And how do we continue to evolve as individual beings and as an organization and humanity at large? I think that is the need of the hour, and it's been a wake-up call.
So Heather, do you want to tell us maybe a few tidbits, few teasers of the kinds of things that you've been able to do?
Yeah, so I think one of the things that when I mentioned earlier that, looking at the positives that have come from the pandemic and our organization's role in that is really how we've been able to, leverage and engage all of our leaders in the organization to both use our values of equity and collaboration to engage some of the society's, Toronto's most marginalized groups, and to align on that as an organization to really see some transformational change. So, from where we were 6 months ago, our organization is a different place, and we've really mobilized our resources, our individuals, our people to embrace the goal of there's a whole lot of people during this pandemic who are just not being served and not being served well, and we're the solution for that. And so it's really a kind of a cascading approach that we've taken, so that it's not just the leadership that's asking those questions. It's everybody, every single individual in this organization's responsibility is to look through the lens of equity in all of that we're doing, and fill the gaps where they exist. So part of what we're talking about is how we get from an organization that, as all large organizations, it's hard to shift and move people. How do we use generative conversations, inspirational goals, appealing to people's humility to advance that agenda.
We've only been on air for a few minutes, and you mentioned equity a few times already, and I'm wondering, it's clearly a core value at the hospital. How much do you think values play a role in what you've managed to do, whereas others may have not been able to do the same?
Yeah, and I spend quite a bit of time engaging frontline staff. I have been over the last year, and really what's inspiring to me is how much all of our staff in the hospital align or identify with the value of equity. And it doesn't matter where you work in the organization, everybody has a story to tell about how they've contributed to advancing equity in the organization. I mean, as a women's focused hospital, we've been around for over 100 years. So we started with the gender equality and equity, and have really parlayed that into equity for all, and really health as a human right. So everything that we're doing, it's about who's not coming through the doors of the hospital, who's not being served well, and how can we toss things upside down so that we can reach them in a different way.
Hari, as a coach as well, what have you noticed that's been different perhaps at the hospital and what you guys are doing in the past 6 months?
So before I delve into that, as part of a coach, I was, like as Heather mentioned, I was one of those people who were mobilized early on. So I was working front, left, right, and center, if I were to say that. So all throughout the evolution of the pandemic, what I felt as a frontline worker or as that foot soldier, so the orders come from above, and it's every single person for every other, right? So what came through from management was that the care and concern So at every step of the way, we had challenges, because one of the initial struggles probably was the innumerable policy changes that we were faced with. Every single day, within 24 hours, we would have 30 or policy changes to what we. So for example, like I was just looking at that screening questionnaire, like when we started off, we had those specific regions, locations in the world. If someone had traveled to, they were to be screened. Over a week, that changed into if you had just traveled outside the country, right? So these policies shift. How do we keep track of that? That caused quite a bit of confusion. But all through, there was this consistent messaging from the leaders, from senior management, stating that we are there for you. We are in this together, and we will see this thing through. So I guess that kind of reassurance, the consistency with leadership, the partnership, I would say, that irrespective of what discipline you were in, what level of care you were involved in, this is a consistent theme, not just then, even now. So that, I think, is admirable, and it has been quite reassuring to actually have that kind of messaging from senior leadership to say, we are in this together. Even though things are changing, we will see this thing through. So I think that has been commendable.
And I would just add, I think there is a lot to being present and being really present. So physically, of course, is important to people, but also really listening to what people are saying and adapting accordingly. And it can be, from the staff being nervous in the early days that they were going to be on an elevator with a patient that had COVID, which actually is a fairly straightforward fix, to, things that are much more complex. But, and then reflecting back to the organization that this is what we heard. We thought about it. And this is what we're, suggesting that we do for it, and, let us know if that serves. And so through this, I, myself personally, and we've had many venues, I've had, I get hundreds of emails from frontline staff making suggestions, and they're all great suggestions, and many of them we've implemented. So, to build on what Hari's saying is, it's that we're in this together. We don't have all the answers, being honest about it, because no one had the answers. And we're, but what we can say is we'll listen, and we are going to create the safest environment possible for our staff and our patients.
And that was not just at a transactional level, it went above and beyond. I work at 2 hospitals, so based on that experience, I would say Women's has gone above and beyond in taking care of the employee wellness, mental health, as well as the physical well-being of it. There were policies which were introduced, which actually took care of how one would go about their routine job, as well as thinking long-term. So that, I think, was really, really beneficial in all of us coming together and pivoting and providing care where it was needed.
That's lovely. It's good to hear good positive stories of things that are working well. And there's my cat.
So cute.
That's Sorsha. Yeah, it's lovely to hear that. And I think it's so important that all of us take care of ourselves physically and emotionally, but especially our frontline workers. Thank you so much. I mean, in general, you guys are amazing. You're literally what's keeping all of us alive. So, so thank you. And also, I'm sorry that we are failing you, because as a planet, we still are. Canada is doing well, but, in general, not so much. So I will, in the notes of this video, I will add a link to your session, which is coming up in like a week and a half, where we can hear more about the success stories and about the wonderful supportive relationship that Heather has with the staff. And we'll hear Hari's perspective as one of those employees and also as a coach. So please join us for that. But before we sign off, I want to ask both of you, what is the one thing that all of us should be doing to help end this thing and to be supportive of your staff, your sacrifices, so that we can see the end of the craziness of the COVID?
I would say it's public health measures, right? I mean, it's the distancing, masking, washing hands, and as hard as it is to not re-engage in society the way we used to resist and imagine the positive future that we're going to have when we're on the other side of this.
Hari, any requests for the public? No?
I would agree with Heather. I would just say, like, there will be a time. So as I was saying, like, we would have our open space. We will have our time today, right now. We just need to take care of ourselves and others. Think global.
And take care of our frontline workers.
That would be
don't hug them. Just support them in other ways, but don't hug them, because this is not time for hugging either.
But
Hari and
we will chat more on that.
Yeah, Hari and Heather, thank you so much for joining us this morning. I look forward to learning much more from you, about you, and about your hospital and the relationships between the staff and the successes that you guys have found. I really appreciate your time, and I appreciate you, and I appreciate everyone who's watching. And if you have not come to any of our sessions yet, what are you doing? AwakeAwareArise.com is where we have the schedule. I know that everyone is zoomed out. I was talking to Hari before we started that I think we all underestimated when we planned this conference how zoomed out we would all be. But the goal here is to make the world a better place, not just talk at each other. It's about sharing. It's about inspiration. So if there's a time that it's worth hanging out on Zoom for an hour and a half or more because you attended different sessions, I think this is the time. But if you don't join us, that's okay too, because we will record and we'll share this far and wide, because we want to reach as many people as possible to share the good work that our speakers are doing. So thank you so much for today, everyone. And I think I will see you over the weekend. If not, then I'll see you next week. Thanks so much for watching.
Okay. Thanks, Magda.
Thanks, Hari and Heather. Bye.